Hi, I'm Kenneth Eagleton, Director of Field Partnerships for IM, and I want to tell you about our partnership with an organization called Beraca in Ivory Coast, West Africa. Beraca actually comes from a Hebrew word that means Valley of Blessing. It is a Free Will Baptist non-government organization that works in Ivory Coast in the area of social work. I guess you could classify it as social work. The way it got started is that in the early 1960s, IM sent out Dr. Laverne Miley and his family, and he was instrumental in starting our medical work in Ivory Coast, in the northeastern part of Ivory Coast, in a place called Doropo. The mission ran this medical facility for many years, even after Dr. Miley left the field. I was there also for about 13 years in Doropo. And then in 1998, the mission turned over the medical work to our Ivorian brothers and sisters. And they set up this NGO called Beraca, initially to run the medical work. And they have been doing so ever since and doing a very fine job of it. We're very proud of the way that they have kept the work going. And they have also expanded into other areas, not just the hospital and curative medicine, but they've gone also into prevention and certain community health programs that they've been involved in. And then they have branched out into literacy, adult literacy, teaching adults in some of the villages in the northern part of Ivory Coast that have never been to school, teaching them how to read and write. They've gotten involved also in helping AIDS orphans, orphans that whose parents have died from AIDS, and they help to take care of them. Some of these children have AIDS themselves. They've been involved in helping children at risk, working with children at risk. And another project that they have been involved in has also been microloans. Free Will Baptist Foundation gave the seed money for a fund from which Beraca is making microloans to families who had no income so that they would be able to set up a small business and begin having an income and then pay the money back. And it's a revolving loan fund. They are involved in several different projects, and we have the privilege to partner with them and to help them out in some of these projects and to subsidize some of their activities. We've also sent medical teams to Ivory Coast to help them in the hospital. We've been trying to help them also to expand and modernize the hospital, modernize their buildings as well as the equipment, and do some upgrading to the facilities there of the hospital. So it's been a privilege of ours to partner with Beraca in Ivory Coast. Practically all of the support that is raised to go to Beraca to help them out comes from the World Missions Offering, the WMO. So it is fundamental that we have a good World Missions Offering to be able to partner with Beraca so that they can continue to do the work, the great work that they're doing there in Ivory Coast. So I want to urge you to participate in the World Mission Offering. Funds from the World Mission Offering go to many of our partnerships, And this is just one more good cause that is funded through the World Missions Offering. Thank you.